Let's face it, stress is a fact of life. This means that people can't really avoid stress, but face coping with it, and this can be easier said than done. The purpose of this module is to help you address stress issues with your patients. You don't have to be a psychologist or a mental health professional in order to help your patients with stress and stress management. If you are, great, then you may provide stress management sessions for patients. However, not all mental health providers provide this service within the scope of their work. It is important to note that managing stress is not restricted to a professional practice, but is part of normal living. Some people develop very effective stress management strategies on their own through personal lived experience. Healthcare providers who do not provide direct stress management interventions can still be extremely helpful to their patients. Rather than implement the intervention, you can help by focusing on the following 4 activities. First, identify. Identify when stress is an issue in the patient's lives, as many patients are unaware of their stress. 2, educate. Spend some time with the patient educating them about stress, how it can affect them, and how stress can be reduced. 3, recommend. In this module, I'll provide straightforward advice that you can give patients to guide them. You can recommend and encourage patients to use these skills as well as their personal resources within their community, and within their social networks as stress management activities. And 4, support. Initiate follow-up discussions with patients about how they are managing stress and support them in their journey. Now, stress is somewhat of a slippery concept. Certainly, it is subjective. When one person might consider exciting what another person would consider terrifying. Consider bungee jumping as an example. Some people pay money to do it, and you couldn't pay other people enough money to do it. So be sure to have patients self-identify their stresses. As well, remember that both positive as well as negative events can be stressful. Patients often overlook the stress of positive events because it's counterintuitive. Research on stress has separated stressful events into 2 categories. One is what are called major life events, things like the death of a loved one, divorce, bankruptcy, etc. And the second are daily hassles. Minor things like being late for a meeting, spilling coffee on a new outfit, forgetting your cell phone at home. Interestingly, daily hassle stress is more often disruptive to the health and self-management because these stresses build and burden, and they aren't often worth talking about and yet still impact. The life event stresses are big enough to engage coping strategies and to elicit social support from others. And the exception to this is if 2 to 4 major life event stresses occur in a short period of time, let's say between 12 and 18 months. And in these cases, then these major life event stresses seem to have a strong impact on health and self-management. Stress management is important for those living with chronic disease because stress indirectly affects health by interfering with self-care, and because it directly affects many of the body's major systems, including the cardiac system, the endocrine system, the immune system, and the muscular system. Okay, now let's get to stress management activities. It will be important to deal with stress at 2 separate levels. First, dealing with unhealthy coping strategies. That is, the recognition of the value of unhealthy behaviors and willingness to change these behaviors. It is important to recognize that many unhealthy behaviors serve a purpose. Emotional eating helps manage emotions. Emotional eating clearly interferes with weight loss and healthy weight, but the point is that it also serves a purpose. Whenever you discover that the unhealthy behavior also has another effect that is positive, managing distress, for example, it is critical to bring this to the surface. Here is where the replacing the function intervention becomes important. By helping the patient develop other methods of accomplishing the goal that the unhealthy behavior accomplishes, you can then use this new method as a replacement for the unhealthy behavior. Giving up the unhealthy behavior then becomes more likely. The last thing we want to do is cause our patients to end up more distressed after they've changed than before because we've taken away a coping strategy. And when this happens, the most common response is for the healthy behavior to be given up and the unhealthy behavior to be replaced because it is the dominant behavior. It's the behavior the individual is more comfortable with. The second level that we'll need to be aware of with regard to stress is stress reduction techniques. Stress is a major factor in people's health outcomes because it affects behavior and it affects the body. A general principle of behavior is that the higher a person's stress level, the less likely they are to engage in self-care, even though the value of self-care is greater when the stress levels are higher. Now, this observation, increased stress, decreased self-care, may seem perplexing, but it occurs for good reason. When under stress, there's a natural tendency for one's attention to be directed to the stress. This is healthy because by focusing in on the stress, coping strategies can be mobilized and the stress resolved. During this time, however, there is little attention paid to the health behavior. If stresses were all controllable in short term, this would not likely be a big problem. But since most of the current stresses a person faces are long-term and less rather than more controllable, this is a natural reaction that interferes with health behaviors. Stress management comes in many shapes and sizes. There is no evidence to suggest that any specific method of reducing stress is any better than any other. The method that is best is the one that makes sense to the individual, that the individual is willing to use, and that he or she experiences as positive. That being said, effective stress management strategies fall into 4 categories. You should encourage patients to become capable of all 4 of these types of stress management activities. And the 4 activities are: first, physical discharge. Exercise and movement is a wonderful way of reducing stress. Much of the stress that we experience in our lives has a physical component, but there's little we can do to physically reduce this stress. So many people are left feeling tense and uptight. Regular exercise, brief periods of movement, going for a 2-minute walk, etc., can be effective ways of discharging this tension. Second, physical and mental relaxation or physical calming. At the same time, the physical discharge reduces stress, so does achieving calm and peaceful states. Relaxation in its many forms is recommended as a coping method. There are many forms of relaxation, from mental to physical. Meditation, yoga, tai chi, deep muscle relaxation are good examples of physical relaxation strategies. Prayer, imagery, listening to music are good forms of mental relaxation. Taking a warm bath in candlelight, reading a book in a cozy corner, etc. are relaxing activities for many. Encourage the patient to explore different methods to find those that work best for them. 3, expressing emotions. There is sufficient evidence to suggest that repressing emotions, that is being upset and pushing those feelings away mentally, is unhealthy for the body. It is important for people to express their distress in the way that they find most comfortable. And if you think about music and art, much of that is about expressing emotions, as an example. And the final stress management activity is seeking social support. A great way of managing stress is to connect with support of others. Humans by nature are social, and in times of stress, reaching out to others can be very effective, even though many people, when they encounter stress, will pull away from people. So this module is designed to help you maintain a relationship with patients that can improve their ability to manage the stress in their lives that interfere with their health outcomes. Good luck.